Good evening, Mid-Michigan. My name is Sarah Grimmer. 13 months into the pandemic, and COVID long-haul patients in Mid-Michigan say doctors are struggling to recognize their symptoms. It's a problem that's created the need for COVID long-haul clinics across the country and parts of our state. Now long-haulers in our neighborhood say we deserve a Mid-Michigan clinic.
This is one that a lot of long haulers are taking. This helps me with breathing and cardiovascular health.
At 24 years old, recently healthy Kelsey Snyder now relies on supplements.
I take 9 every day
to manage COVID long-haul symptoms.
I got COVID on December 20th, 2020. My husband had symptoms 3 days before I started showing symptoms, and then I got what felt like a cold or maybe a sinus infection on the 20th. And then I was fully recovered and everything was good after that. And then end of March comes and just out of nowhere, I get hit with symptoms.
3 months after supposedly recovering from COVID, Kelsey still had long-haul symptoms known as POTS, postural orthostatic tachycardia syndrome. This includes dizziness, intense fatigue, and inability to exercise.
I woke up one morning dizzy, couldn't walk around my house just because I felt like I was so wobbly.
It's symptoms like this that Kelsey says Mid-Michigan doctors struggled to identify.
So I went to urgent care twice, and both times they just said anxiety. That's like the story. I don't know if you're a part of any of these Facebook groups, but everybody, like the beginning of their story is like, I started having shortness of breath and I went to the doctors and they just said it was anxiety. Like, it's not just me, it's not just people in Michigan, it's people all over the place.
One of the groups Kelsey is talking about is Michigan COVID-19 long haulers. I joined to see if members were having the same struggles as Kelsey. They were. With their permission, I can share some of their private posts, including this one, where a woman named Susan shares she had to drive 180 miles to the Cleveland Clinic for care. Many COVID long haulers are feeling like their sickness is being written off.
Hello there.
Hello, Dr. Zeroukian. How are you today? Dr. Michael Zeroukian, the Vice President and Chief Medical Information Officer with Sparrow Health System, says he acknowledges many COVID long haulers are initially being misdiagnosed. Is it a struggle to identify COVID long haul?
I think it can be. When symptoms seem medically unexplained, we are too prone sometimes to attribute them to stress or anxiety rather than the pathology that is COVID. Even in an area like this where we've had a lot and we've talked a lot, there is still that tendency in many cases to underestimate the ability of COVID to cause persistent symptoms. And that's really unfortunate for patients. And we continue to work hard to make sure our providers are well informed about symptoms that are otherwise unexplained but follow COVID.
A recent study from the University of Washington shows that many COVID long haulers, like Kelsey, were originally only mild COVID cases. Dr. Zeroukian says there's no specific data, but somewhere between a quarter and a third of COVID patients who come through Sparrow may become COVID long haulers, having symptoms that persist for 12 weeks or more.
And sometimes they're minor and sometimes more severe.
There are clinics in Ann Arbor and Detroit created specifically for COVID long haul patients. But more than a year into the pandemic, and there are still no COVID long haul clinics for patients in Mid-Michigan like Kelsey.
Finding an actual clinic that's close in my area just feels kind of like impossible right now.
Is Sparrow Hospital considering a long-haul clinic? Is that something that's on your radar?
So that is on our radar screen with regard to monitoring it. And I think probably the indicator of whether it's time for us to develop such a multidisciplinary clinic is how many patients we're seeing that we are otherwise needing to refer to one of those other locations, such as in Ann Arbor. And if that became something more than an occasional need, we would certainly want to consider that.
While we wait to see if a COVID long-haul clinic will open in Mid-Michigan, those like Kelsey who are struggling ask for at least one consideration. What would you like people to take away from this?
The doctors are doing their best, and I obviously appreciate everything that they do, but it's really important that people take the extra time to listen to the people who are saying, like, this is going on.
The CDC recognizes on their website that clinicians and researchers are still in the early stages of understanding long COVID. There are multi-year studies researchers are currently in the middle of that they say are going to be crucial in treating patients. I'm Sarah Grimmer reporting.